Viewers, welcome to the session. So today is November 14, World Diabetes Day. So today with us we have Dr. Mahesh DM, our consultant endocrinologist. Welcome sir. And Dr. Maitri, our consultant lifestyle medicine and nuclear medicine to discuss regarding diabetes. So before we move on to the questions from the audience, I have some questions which we usually get most from our OP patients and all. I would like to ask you both. So the first question is to sir. Sir, what is diabetes and why is it become so common?
Good evening viewers. Today is World Diabetes Day, November 14th. This is celebrated in view of the birthday of Dr. Frederick Banting, who had discovered insulin. In the last 100 years, diabetes has grown in leaps and bounds, and in the last 30 years itself, we have seen that the diabetes population has increased by 4 times across the world. Diabetes means that the blood glucose levels are high in the body, which is diagnosed with values like fasting sugar of 126 and post-meal glucose level of 200. Or we have a new test in the last 10-15 years which we call as glycated hemoglobin. If it is more than 6.5%, then we call a person to have diabetes. One of the major reasons for diabetes to explode in such a way is change in the socio-economic environment and our eating habits, with consumption of more simple carbohydrates and refined foods, and reduction in our corresponding physical activity. And this has multiplied to an extent that diabetes, which was common above the age of 50, is now common in the age group of 35 or more.
Okay, sir. So once we have diagnosed with diabetes, how about the treatment part? Like, will we all the patients will be requiring medicines in the initial stage, or else like even if we are prescribing medicines for the patients, there will be a number of questions like adverse effects. What all are the adverse events that can occur while the patient is on a diabetic medicine?
So the first thing we know now is that diabetes as such is recognized by symptoms like excessive urination, increased thirst and weight loss. It can also be detected when some wounds are not healing, or when somebody has giddiness, fatigue or burning sensation in the feet and legs. But this is seen only in 20 to 30% of the population. Rest of them do not have any major symptom and is usually recognized during a blood test. So once we diagnose somebody to have diabetes, depending on the glycated hemoglobin values, we decide about whether we should give medicines or we can manage with lifestyle that we will discuss. So it's important to understand that diagnosis of diabetes does not mean that all patients should be on medicines. But unfortunately, there is a myth that if I tell that I have sugar, the doctor will start medicine. So let me wait till I develop symptoms, then only I will start medicine, or then only I will accept the medicines. So this will lead to complications that will affect the major organs like heart, kidneys, our eyes and our legs. So that's why we always tell patients to first detect. Unfortunately, from the data that is available, we know that at least 40% of the patients are moving around with diabetes and are not aware that they have diabetes. And another 20% of them, though they know that they have diabetes, they are not either consulting for lifestyle changes or medicines, because they think that I don't have any symptoms, so why should I go and take care. So I just give you an example like termites. Termites are eating the wood from inside. As soon as the termite enters the wood, you will not see any change in the strength of the chair or wood wherever you are seeing. But after some time, you will see that the chair has suddenly collapsed because you could not recognize it. So in the same way, the glucose levels that are high will cause damage to the organs even without causing symptoms. Therefore, lifestyle changes with food, exercise, and in some cases medicines are essential. So now coming to medicines, not that all patients require medicines, and not that once we start medicines we can never reduce them or stop them. What happens is that the medicines will definitely work only if the patient is also taking care of lifestyle changes. And these medicines have some adverse effects like GI intolerance, diarrhea, nausea. Sometimes they can develop B12 deficiency. Some medicines lead to weight loss. Some cause genitourinary infections, and sometimes, rarely, they can also be associated with diabetic ketoacidosis. Others cause nausea and vomiting. Rarely, they can also be an increased risk of fractures in some medicines. So depending on the lifestyle, we will give the lowest common denominator, that is the medicine that will have the least amount of adverse effect to the patient. So our goal is to improve the lifestyle so that the medicines are either reduced or stopped so that the adverse events are not faced by the patients.
Thank you, sir. Next question is to you, ma'am. So, as sir has mentioned, like the first question when we start on medicines, that patient will be thinking like, can we stop the medicine or is it reversible diabetes? So, is diabetes really reversible, or does it mean like all diabetes can stop taking medicines, or else they will have to take it lifelong? How it works?
This reverse disease is a concept which has to be understood in its own sense. It only means that the diagnostic parameters, which Dr. Mahesh just explained, the numbers, your fasting blood sugar level or HbA1c level, whatever numbers we are looking at to make the diagnosis of diabetes, these numbers can be handled and they can be brought back or brought down to a level where it's normal. So that is the essential meaning of reversing diabetes. And can diabetes be reversed? It's a new concept. I think 2021 Banting Memorial Lecture, a lot of new research coming up which is substantiating that yes, it can be reversed. But also, can it be reversed in all patients? But it really depends on the type of diabetes. Is it, we know that there is type 1, type 2. In type 1, there is, very neonatal, which is kind of genetic, and that is treated only, can be treated with tablets and not, it's the other kind of type 1 which needs insulin. In the same way, type 2 diabetes, there are many different kinds. There is, a group of patients who have increased insulin deficiency. There is another group who have increased insulin resistance. There is a third category which is a combination of these two. And then there is a fourth category which is like age-related, mild category. So as of now, when we see across, right, all of them are being treated the same way with medications or insulin and so on and so forth. Yes, diet, exercise is mentioned, but not with the necessary emphasis. The new research which is coming out now, all the top organizations, ADA, IDA, all the international organizations also now confirm that lifestyle changes can definitely make a change and reverse the diseases, especially diabetes. So yes, how we do it is once we make a diagnosis of what type of diabetes and what stage also is important, how early or how these markers are, that's how the physicians will kind of decide and then take it forward.
Okay. So, what is the role of lifestyle medicine in this one? Like, why should patients do lifestyle modifications? Because it is not that easy as it may sound. Like lifestyle modification, making some changes to our own daily routines seems difficult to most of the patients. So, why is it so important?
See, lifestyle medicine in itself, it's a new subject, maybe a few 5-10 years old in the allopathic or the modern medicine science. But it's also like, to me, it's like wine in a new bottle. It's been always around in the Ayurvedic sense. Even in Ayurveda, a diagnosis of diabetes was made, in Sushruta and Charaka's ages also. But it has evolved over the last 100 years. When insulin was discovered in 1921 to today, it's about 100 years, and a lot of new things have come up. And of late, more and more recognition of this is coming into the allopathic or the modern medicine also, that lifestyle is the most important in managing these kind of diseases. It basically works on 6 pillars. The main pillar is food. It also looks at physical activity, exercise and fitness, sleep, stress management, and positive psychology, and also avoidance of risky substances. So these are the basic 6 pillars which works around. But the major difference is that it addresses the root cause, which is the inflammation in the body due to many external factors, and how the patient themselves or the person who is inflicted with this diabetes can take control, can be in the driving seat, and what can they do, everything possible in their capacity before they resort to medications or insulin or such and such. So that that is the essence where it looks at it at the first basic foundation of management of diabetes. And if that doesn't work, that's when everything else can kind of come in.
So, sir, you were mentioning that around 40% of people is roaming around without knowing that they have diabetes. So, this will be again a question like, I don't have any symptoms of my own, then why should I go meet and why should I control my sugar values? Because if we meet a doctor, they'll say certain restrictions. So, why should I obey that? There will be like, we'll have to give a good reason for like why we should control our glucose levels and what are the complications if glucose levels are not controlled.
So there are, like we all know, diabetes is a chronic non-communicable disease where the blood glucose levels are going to be high. These high blood glucose levels, depending on the rate at which it increases, will cause symptoms and complications. If somebody has glucose levels increasing very fast, say if it was 100 or 110 today, and within 1 month or 2 months it became 250, 300, those patients are likely to develop symptoms that will be like increased urinary frequency, increased infections, respiratory and urinary tract infections, and sometimes wounds that are not going to heal, or cellulitis which will affect usually the legs. So these are the acute problems that are related to high blood glucose that occur usually when the sugar levels rise fast. But in many patients, the glucose levels will gradually increase and the body starts getting adapted to these increased glucose levels. But the only difference will be that the patients will not have acute symptoms in the beginning. The glucose levels increase up to 400, sometimes 600 or 800, and the patients will then start developing symptoms. So in few patients, 200 to 250 may be symptomatic. In other patients, 400, 500 or 600 may be required to make them develop symptoms. But once the glucose level starts increasing above 100, 126 and after food 200, it already starts making changes in the blood vessels. These blood vessels become stiff, they become narrow, and then gradually start damaging the organs. So we call them as, what are the organs that are damaged? Are known as the microvascular and macrovascular diseases because of diabetes, or microvascular complications and macrovascular complications. Macrovascular complications the pathology starts even during the pre-diabetes stage, where the blood vessels become stiff and hardened and get blocked, which will affect the heart, the legs leading on to amputation or gangrene, and the brain leading on to stroke. Whereas the minor vessels that get affected, they get affected very slowly. Usually 5 to 6 years after getting diabetes is when we see these problems. Those are going to affect the eyes, the kidneys and the nerves. Today, the leading cause of renal failure or kidney failure is diabetes. The leading cause of blindness is also diabetes. So these complications will be slowly progressive, but without any symptoms directly. The patient may come with a high creatinine or swelling in the legs and breathlessness affecting the kidneys and the heart, or come with a paralysis, stroke, or he may directly develop visual loss, sudden blindness can be there. That is why we need to identify the glucose levels earlier, so that we control them earlier, and once we control the blood glucose levels earlier, the chances of complications reduce by almost 70 to 80% in most of the patients, and in the rest, even though they may develop complications, it will not be severe enough to affect their health. So the difference between identifying diabetes and treating it is 8 to 12 years. So if somebody does not identify that they have glucose levels high and do not make any lifestyle changes or start medicines on time, they are likely to lose up to 12 years of their lifespan. So that's why lifestyle plus or minus medicines is the key to controlling blood glucose levels, preventing the acute and chronic complications that are related to diabetes.
Okay. So, ma'am, you were earlier mentioning regarding food as the first pillar and then physical activity. Sir was also telling regarding the same. So, one of our viewer had one query. He is a 45-year-old male patient. He is leading a good lifestyle, but still he got diabetes. So even if like we used to see the patients like that, they'll be leading a good diabetes and a good lifestyle, but even they'll be having diabetes. Or is it sufficient that the patient is having a good diet, doing regular physical activity, walking every day, giving up white rice and all, is it sufficient for controlling diabetes, or will they may need medications, or what is the chances of people with good lifestyle getting diabetes?
See, this good lifestyle is used in a very generic or a very vague pattern. What is good to me might not be good to you or somebody else. What is good for one patient is not sufficient enough for another patient. So, what I think this is healthy, there is a lot of wrong information or inappropriate concepts being promoted by this. I've seen vendors selling stuff with sugar as the number one ingredient, but it will be packaged as healthy. So there is a lot of wrong propaganda happening in what is considered healthy. For diabetics, it is very important to understand some basics, and that's what our programs are structured to do. It's like, if you want to learn dancing or singing, it's not enough that you read a book or you see somebody doing it, or a few people might have that capacity to do it, but if you want to do it at a proper professional way, you need that kind of training or coaching. What this coaching or training involves is teaching them what is food, what are the components of food, what is glycemic index, what is calorie density, and what is glucose load, and how this is different in each different type of food which they eat. That is the major missing knowledge part for most of our patients. They feel they are eating healthy. Oh, I'm not eating rice, I'm eating chapati. That is not sufficient at all. I'm not eating rice, I'm eating ragi or some other millet. Not all millets are equal. There are about 9 to 10 millets. Only 2 or 3 come as close to quinoa, oats, which are kind of expensive in the Indian context. But it is understanding that thoroughly, which is true knowledge, and just saying I'm leading a healthy lifestyle doesn't cut it. And in lifestyle medicine physicians, we also do fitness prescriptions. It's not just 30 minutes of walking, right? We teach them, there is so much, there are so many different types of exercises and different muscle building, for example, or balancing, or what age group will benefit more from which particular type of exercise. And the fitness prescription itself has different components to it, frequency, intensity, timing, type of exercise. So when generically people say I'm living a good lifestyle, that is where we would start understanding what it means, what are they doing, and then making one change every day to make them reach their health goals in a very smart way, specific, measurable, attainable, time relevant, time friendly, time bound and relevant in that particular context. So what I'm trying to say is, we might think we are doing everything, we are living a healthy life, but there is so much more in depth to be understood about it, and only once you understand and inculcate it part by part, if gradually, you can truly see that change and realize the difference of what you thought was good lifestyle today, but how much more efficient you can be in doing whatever, by eating what you like to eat or walking where you like to walk in a more efficient way. It could be just wearing, ankle weights or wrist weights when you're walking, or keeping up your heart rate, monitoring. There are so many things which they need to be taught. So that's how our programs are also going to be are being structured, where we can handhold them and teach them these kind of basic skills. It's like skill building. See, when it comes to food, right, it is the willpower. It's resetting the mindset, which it's the willpower which tells you, right or wrong. But that's the easy part. But for you to be doing the right thing every day, that's skill power. That has to be sustainable long term, that you're happy eating that. If you're a rice eater, you need to make dishes which taste the same or look the same or give you that amount of same satiety. For Indians, South Indians, maybe for North Indians, there are so many other things, what their palate is used to. So understanding that, starting with their 3-day diet history and making those changes, that's the mentorship or the coaching which a lifestyle medicine physician can give, and truly understanding it in that.
Okay. So lifestyle modification has a very good effect, especially in newly diagnosed diabetes patients. So what are the basic things they'll have to be taking care, especially in newly diagnosed diabetes patients, and how can they change their lifestyle, like basic things? As you said, individually it varies for each and every patient, but basic things, even if like newly diagnosed diabetes patients, what all they can change and how can they implement that?
Definitely. First, understanding what basic knowledge about what is what. That is the basic step. Once you get that, then it becomes easier to make those changes. It's not very dictatorial, do this, don't do this. It's easy to say, don't eat this, don't eat that. What is important to teach them also, and for them to understand also, what can you eat, what more can you eat. Predominantly plant-based, whole foods, low fat, definitely, calorie restriction, exercising regularly, stress management, all of them are known to tackle and bring down insulin resistance in multiple different ways. So that would be a path forward for them. Diabetes is almost like a tiger. I would like to compare it to that. It is there. As long as it is in a cage and you're controlling it, it is good. The minute you let it out, that's when the trouble starts. It's understanding how to keep it in control, keeping the blood sugar levels low, so none of the complications Dr. Mahesh was explaining, microvascular or macrovascular. It's only when the sugar levels are constantly high for a long time, that's when it hits the eye or the kidney or the brain. That's when you see these complications. That's when the tiger comes out and starts to. So keeping it under control and in a cage, and what can you do in all these 6 pillars, in depth, getting more and more knowledge and not just very superficially. I think that's where most of our patients get disheartened. They feel that they are doing it, but that's not enough. That is the key. Once you learn, it's like I said, learning to sing or dance. They might just do, but only when you look at yourself in the mirror or hear yourself, you see the difference, right? So there is so much scope for improvement and doing it better.
Sir, so as we were mentioning, like there are different kind of diabetes. So in that, type 1 diabetes, that is like kids having diabetes, is one of the most serious issue we are facing now. So what causes diabetes in children?
So like we just discussed, diabetes, there are various forms of diabetes. Type 2 diabetes also has categorization today, where we look at insulin deficiency, insulin resistance, a combination of both, and age-related decline in the natural function of the pancreas. So in those patients are different from those are usually related to lifestyle and aging problems. Almost 90% of it is related to that. There is some genetic component to type 2 diabetes which may account for around 15 to 20% of the people, where still the damage to the pancreatic structure or the organs is very slow, so we can manage them with medicines. Whereas in children, there is what we see as type 1 diabetes is the most common form of diabetes. It can also be seen in adults or elderly patients, but it is very common in children, usually above the age of 2 years up to 16 to 18 years. In this group of children, we say a combination of genetic risk with environmental factors are contributing to the development of type 1 diabetes. Now, there is nobody to blame for this. Sometimes these genes are not even inherited from their parents. They can be seen in siblings, like twins or siblings can have similar genes and develop diabetes, but it is not that if a parent has type 1 diabetes, the kid will get type 1 diabetes. Or if the parent has type 2 diabetes, the kid will get type 1 diabetes. So type 1 diabetes is mainly because of genetic risk, over and which there is an environmental factor. Today we have a lot of natural toxins that are available, that are present in our food substances. It may be pesticides or chemicals or some storage items that we use that may trigger the immune system to cause damage to the pancreas. That is one of the reasons why type 1 diabetes develops. The second most common reason attributed is some viral infection. We don't know what is the actual virus that may be causing, because the infection might have happened many years ago, and that infection, if it affects the pancreas, it will create a memory in the body, which we know as an autoimmune phenomena, where the body produces chemicals, antibodies against the pancreatic beta cells, and when they are destroyed, the insulin levels decline and sugar levels just shoot up, resulting in a condition called diabetic ketoacidosis, where acid production is very high in the body, leading on to many times they need to get admitted, they have breathlessness, they may be comatose, they may require ventilator support, and this can be managed only with insulin. There is no other medicine for type 1 diabetes except insulin. We also see that some patients think that type 1 diabetes can be cured, or I can manage with medicines or other forms of treatment. As of today, there is no evidence to claim that type 1 diabetes can be cured. It can be controlled, it can be managed. I know doctors who are living for the past 60-70 years with type 1 diabetes by taking insulin regularly on time. The advancement we have is in the form of insulin delivery systems. We have insulin pumps, modern insulins, which are very good, have reduced our risk of complications, and most of the kids can live their full life by taking insulin in the right way in consultation with their doctors.
Okay, sir. So as you were telling regarding insulin, it is the 101st year of the discovery of insulin, which has been a huge milestone in the treatment of diabetes. So there are certain myths which surround regarding insulin. Like initially, if you are starting insulin, the patient will be asking, should I be on insulin all the time? Is there any reversal? Is there any way without taking insulin? So, or will the insulin cause any organ damage? So, what is the reality, sir? Will the insulin cause any kidney or organ damage, or is it a myth?
So insulin is one of the greatest discoveries in humankind in the last many thousands of years. You can call it the miracle drug because it actually saves lives. We have seen kids, survive just by taking insulin, which was not, accessible or available. At least 20-30 years ago, insulin was available only in cities. In rural area, they used to come and carry. And even when I was finishing my post-graduation 10-15 years ago also, there were areas in the country where insulin was not available easily. They had to travel for distances to carry the insulin. So insulin is a miracle hormone. It is something that is produced in our body and available in a modified form or externally. There is no side effect of insulin except low glucose. If you take insulin and you don't eat properly or you exercise too much, you may get low glucose level. Otherwise, there is no other major known side effect of insulin. Insulin is a miracle medicine that, if taken in the right way, will lead to changing the quality of life of the people. Now, coming on to the important question of whether we start insulin, should we continue lifelong? No. The answer is frank no. In fact, if we start insulin in the beginning for many patients, even with type 2 diabetes, we see them doing so well that at the end of 3 months or 6 months, we not only stop the insulin, but we also wean them off the other drugs also that may be required initially for blood glucose control. As Dr. Maitri very well explained, the role of lifestyle medicine in not only reducing the medicines that the patient is taking, reversing diabetes, that is bringing down the glucose level to a level that is acceptable to the patient where medicines are not required, and also in many patients we can stop insulin if they change their lifestyle to such an extent that it makes a difference. We have seen from studies that if somebody who is obese has insulin resistance, they reduce their weight by 7 to 10%, they can reduce their medicines by 50 to 60%, and if they lose weight by almost 15%, they can actually stop some of their medicines, and insulin can also be stopped in many patients. So if you start in the beginning insulin, only 5 or 10% required to continue it long term, and if you start later on, say 5 years, 10 years down the line, you start insulin, that can also be reduced with appropriate lifestyle changes in almost 30 to 40% of the patients, by adding new medicines or by making sure that their lifestyle is modified in such a way that the insulin dose requirement can come down, and if they are taking once daily insulin, that can also be stopped in almost maybe 25-30% or even up to 50% depending on the duration and severity of diabetes.
Okay, sir. So coming to the lifestyle, ma'am, the modern lifestyle comes with lot of stress. So what is the role of lifestyle medicine in management of stress?
Stress is a very integral, management of stress is an integral pillar for lifestyle medicine. And stress, we usually look at it from a very negative aspect. There is the good kind of stress, which is like a little bit which is needed and it is good. It's called the eustress. That's what gets you into the flow zone. It's like the stress when we get during exams. It's that like little pickle on your plate. You need it to, it adds a little bit of positivity. but it's the bad kind of negative stress, which it's known, proven that stress itself can cause diabetes. We've had patients, VIP executives who some stock market crash or they lost their job. They're absolutely fine, 45, 50-year-old. Immediately blood sugars go haywire, stress. Body has its own mechanism to deal with stress. It is the flight or the flight response. Um, uh, Teaching patients or patients understanding how to manage this. These are skills which are again acquired. It could be mindfulness, or it could be engaging in we call it positive psychology, PERMA. Multiple pillars to it. It's not something which can be done in such a short session. Maybe exploring those kind of things, teaching them, it could be just pranic breathing or yoga, anything which they are doing by themselves also definitely has an impact in controlling the multiple hormonal imbalances in the body. And one more thing Dr. Mahesh was mentioning, about the food. There is so much knowledge to be acquired about it. In fact, it's all explained in the book which recently came out. Is we talk about everything. There are endocrine disruptors. There is plastics, for that matter, can cause a disbalance. Multiple things could be what you buy, reading your label, how you cook your food, alternative cooking techniques, how you can avoid oil, salt, what are the type of recipes, what are the alternatives to these kind of irritants. It could be animal-based products, what are the plant equivalent to that, because it's been proven that certain animal products are inflammatory to the body, and that itself causes inflammation and all these inflammatory kind of diseases. Not just diabetes, even heart disease and sometimes cancer, they are all lifestyle related. So when we structure these programs, all of them are given equal importance in equipping the patient to be able to do this by themselves in a very comfortable, easy way in their home, long term. And it's not some one day I do and tomorrow I become okay. It's not like that. It's gradually scaling up, learning, making one small change and learning a new habit every day. For me, it took me about a couple of years, maybe about a year or two, where you introduce them, you prep them, then there is a maintenance phase, and then there is gradual, sometimes lapses can happen, so kind of showing them how to maneuver through this.
So, we don't have any more questions. So, Mahesh, what is your message to the world for this World Diabetes Day?
So today, we have spent last 20-30 years learning about diabetes and trying to teach diabetes. Unfortunately, we have been teaching diabetes only for those who come to us that are diagnosed with diabetes. So today, the main message or the theme for World Diabetes Day is to educate to protect tomorrow. That is, let us all learn about diabetes. Let us all see if we have risk factors or any symptoms, and let us all check our blood glucose levels and see if we are in a pre-diabetes stage, or we are at risk of developing diabetes, or do we already have diabetes. So let us all learn more about diabetes, how we can detect it, diagnose it, and also treat it. Remember, treatment does not mean always medicines. I want to make it very clear to all people listening to us, or who can spread to their relatives and friends. Please don't think that just by detecting a high glucose level I need to start medicines immediately. No. Today the lifestyle medicine and the lifestyle changes that have been done in the last 30 years have proven to us that lifestyle changes are the best way in order to reduce the glucose levels and also prevent diabetes in those people who don't have diabetes, that is in the pre-diabetes stage. And now we moved further towards a stage where we can reverse diabetes in almost 50% of the patients, especially if they have been diagnosed to have diabetes with insulin resistance within first 5 years of the diagnosis. We are able to reverse their diabetes, that is, we are able to stop the medicines if they are taking medicines, by promoting lifestyle changes that can lead to weight loss and improvement in the quality of life, reduce stress, integrate the exercise regimen in their life that can help them, and also reducing alcohol intake to very moderate levels and stopping smoking will help in a long way in reducing the burden of diabetes in our world and our population.
Okay, sir. Thank you. So, to you, ma'am, your final message on this World Diabetes Day.
I think it's kind of become the norm. Even I have had patients tell me, when I become old, I will get diabetes. So let me live today. I mean, now I am young and healthy. I think that is the kind of mind shift change I would look forward to bringing in, and that's my personal take on this as well. This is certainly something which can be preventable if we can take care of things early on. You can still eat and enjoy life and what you like to do, but if you can have that discerning eye when to do in limitation and moderation, you can definitely prevent diabetes. And if at all you have already been diagnosed in the pre-diabetic phase, you can definitely control and kind of reverse the disease. And if you are already a diabetic and if you are on medications, certainly a lot of my lifestyle changes can help you reduce the medication burden. And this is not something which will be attempted by yourself. Definitely hand in hand with the physicians who have been giving you these kind of medications. Do not risk it, because it's not something, medications are being given to you for a reason, and we are trying to replace that with lifestyle if and when you can make those changes. So it has to work hand in hand. That is very important. And 100 years ago insulin was discovered. Maybe 100 years away from now, maybe if we all are able to fix our lifestyles, we will be in a place where diabetes is no more, eradicated, hopefully, at least the type 2 insulin resistant kind. And smallpox we've been able to eradicate. So maybe 100 years from now, we won't have a reason to celebrate Diabetes Day. I hope that's my wish. And so take care and God bless.
Okay, doctors, thank you for the wonderful session. So let's hope for a future where there is no diabetes, as ma'am has mentioned, a world without diabetes, so that, as the message says for the World Diabetes Day, educate today to protect tomorrow. So we hope this session was informative for all the viewers.